Hello everyone, today we are going to learn about your HPV, that is the human papilloma virus. So let's learn about the HPV, what are the serotypes of HPV, why should we need to screen and vaccinate the people for the HPV. So let's learn about that in the point of view of your examination also. So HPV, that is your human papilloma virus, it is a double stranded DNA virus, okay, and it need intact squamous epithelium cell to complete its cycle. To survive, it need a intact squamous epithelial cell. What are the changes it brings in the squamous epithelial cell? It converts the squamous epithelial cell into the chiliocytic cell, that is the cell with the perinuclear halo. Now, what are the genes of HPV? HPV has E genes, that is your early genes, and L genes, that is a late gene. Okay, now these E genes are expressed in the basal layer of your squamous epithelial cell. What are the early genes? E1, E2, E4, E6 and E7. And what are the late genes? That is your L1 and L2. Now we will learn about what is the function of these E genes and L genes. Now this is your E1 and E2. These are important for your viral replication, and this E6 and E7, these are important for your malignant transformation, out of which E7 resemble a P53 gene, which is a tumor suppressor gene, and bring about the malignant transformation. E7 like a retinoblastoma gene, RB gene, bring about the malignant transformation. So this is about the replication, this is about the malignant transformation. Now what is the function of these late genes, that is L1 and L2? This L1, which is a major capsid protein, help for the HPV vaccine, and this L2 has no role, minor capsid protein. So this is about the HPV and their genes. Now what are the serotype of the HPV? There are various serotypes, out of which some are high risk serotype, some are low risk serotype. Low risk, we have HPV 6 and HPV 11. These are low risk, means no cancer. They generally cause a genital wart and recurrent laryngeal papilloma. These high risk, these are 16, 18, 31, 33, 45, 52 and 58. They causes a cancer. They have malignant transformation capability. Like in the male, they causes oral cancer, penile cancer, anal cancer. In the female, they causes the cervical cancer, vulval cancer, vaginal cancer. And this CS cervix, 80% of the CS cervix are caused by this 16 and 18 serotype. So these are very dangerous serotypes, 16 and 18. Now we will learn that is the most common HPV serotype causing the CS cervix. The first most common is again your 16, causes 55% CS cervix. Second most common is your 18, and third most common is your 45. Remember about this point. This is most common HPV leading to CS cervix. Which is the most specific HPV leading to CS cervix? That is your 18, and also it is the most malignant HPV serotype. Okay, so this is about 60 and 80. Most common HPV leading to the anogenital or oropharyngeal cancer or CIN3 is again HPV 60. Now 16 is mostly associated with squamous cell carcinoma, okay, while 80 is mostly associated with adenocarcinoma. So these are the points you have to remember about the 60 and 80 serotype. Now after the genes, replication, serotype, what is the transmission, how this HPV is transmitted? So two routes, congenital and sexual. In congenital transmission, you know that if the mother has a genital warts, then it will be transmitted towards the infant. Now if mother has a genital warts and these are the small genital warts, okay, then you should carry a normal vaginal delivery, no need of C-section. But if the warts are large enough that they obstruct the normal vaginal delivery and they are bleeding, then only C-section. So normally no C-section, but if there are large ward and obstruct vaginal delivery, then only we can do a C-section. Okay, now this is about the congenital transmission. What is about the sexual transmission? It is oro-anogenital route, and it basically this HPV goes into the basal layer of epithelium and replicate or transmit there. Now after the transmission, this HPV mostly clear out. If there is latent infection, it causes ward. Okay, but this HPV persists greater than 6 months, then it can causes a CS cervix. That is your E6 and E7 gene, which are helpful for or responsible for the malignant transformation. Okay, so this if persists greater than 6 months, that's why it is very important to diagnose and treat early. Rather, it is very important to prevent by vaccination early. Now that's why we screen for the CS cervix. We not only screen, we also vaccinate for the CS cervix. Now why do we need to screen for the CS cervix? Because it is most common female genital tract cancer, that is your CS cervix. Okay, and infection, after the infection, it can lead to cancer or it convert to cancer by 10 to 30 years. 10 to 30 years required to convert it into the cancer. So we don't know when the infection is going on, or we don't know when will we convert to malignant transformation. So that's why we need to screen for the CS cervix. So, and also it is the fourth most common cancer in the female, that is your CS cervix. Which is the first most common cancer in the female? That is your breast. So fourth most is CS cervix. That's why we need to screen for the CS cervix, and also we need to vaccinate for the CS cervix. Okay, now how the vaccination process is going, or which are the vaccines? So there are 4 types of vaccines made for the HPV, that is the bivalent, quadrivalent and novalent. Bivalent, we have we have one vaccine, that is a Cervarix. In the quadrivalent, we have Cervavac and Gardasil, and novalent we have Gardasil 9. Now the bivalent cover 2. This is for the 2, that is your 60 and 80. Cervavac, that is the quadrivalent, both cover 6, 11, 60, 80. And this your Gardasil 9 cover almost all serotype like 6, 11, 60, 80, 31, 33, 45, 52, 58. That's why it is most commonly used in India. Now this bivalent vaccine protects against only CIN and CS cervix. This quadrivalent protect against CIN, CS cervix plus anogenital ward. This quadrivalent also same CIN, CS cervix, anogenital ward, but this novalent is CIN, CS cervix, anogenital ward, vulval cancer, vaginal epithelial cancer, oropharyngeal cancer and head and neck cancer. That's why it is most commonly used in the India. That is your Gardasil 9. Okay, now dosage, all are 0.5 ml intramuscular dose. Okay, now what is the ideal age? All have 11 to 12 year is the ideal age for all, but most common in India 9 to 26. Okay, now age can be extended up to 27 to 45 year according to your gynecologist opinion or gynecologist advice, but no vaccine should be given before the age of 9. That you have to remember. Now what is the schedule? That is like your HPV vaccine or HCV vaccine, it has also schedule like 0-1 6 month, 0-2 6 month, 0-2 6 month and 0-2 6 month, and this adjuvant is not so important. Okay, now what is about these vaccines? These vaccines are highly immunogenic vaccines. They do not resolve pre-existing infection or neoplasia, because vaccines are for what? To prevent, not to cure. Okay, now if you want to switch the vaccine from bivalent to quadrivalent, suppose you take the 1 dose of bivalent, you want next dose of quadrivalent, so take next dose of quadrivalent. No need to restart the vaccine again. Okay, if you have interrupted your schedule also, no need to take dose from restart the dose, you can continue the dose. Okay, now ideally this vaccine is contraindicated in the pregnancy, but by chance you give, no need to take any action. It is safe also during the lactation also, and it is also contraindicated in the people having the yeast allergy and recent febrile illness. Okay, and most common side effect, as like all vaccine, that is your syncope after taking the vaccine. Now generally in the India we follow the rule, that is before 15 years you give 2 doses, 6 to 12 month gap, and after the 15 year you give 3 doses. First and second dose have 1 to 2 month gap, second and third dose has 6 to 12 month gap. But in 2022 April, WHO bring new guideline, that is 9 to 40 years 1 or 2 doses, 50 to 20 year 1 or 2 doses, greater than 21 year 2 doses 6 months apart, and only in the HIV positive you will give a 3 doses. So this is about HPV vaccine. Now other type of serotypes like 1, 2, 3, 4 we have not seen. So these serotypes also associated with other diseases apart from the genital cancer, like your 1, 2, 3, 4 are associated with common warts like verruca vulgaralis and plantar warts. Is your 6 and 11 associated with condyloma acuminata, sinonasal papilloma, and squamous cell papilloma of the larynx. This your HPV 16 is associated with low grade squamous intraepithelial lesion, high grade squamous intraepithelial lesion. This Bowen's disease, what is Bowen's disease? It is the carcinoma in situ of the male external genitalia. This associated with vulval cancer, oropharyngeal squamous cell cancer. This 80 associated with again high grade squamous intraepithelial lesion, low grade squamous intraepithelial lesion, CA cervix and CA anogenital. Now 5 and 8 CA squamous cell carcinoma of the skin, epidermodysplasia and verruciformis patients. So this is about the HPV, all you need for your examination purpose and day-to-day life. So thank you.